Why psychiatry, Dr. Joan? That's a question I'm answering a lot lately. Another person told me if you gave me time to sit down with you, I'd convince you to look into another field. Another person recently commented, you should be very careful. Now the very funny thing is all these comments are from my colleagues, health workers. Judgment of someone before you even know anything about them. I've done it. You've done it. We've all done it. And it's called stigma. Today I'm here to talk about stigma of mental health. I'm Dr. Joanna Batio. So join me today as we talk about stigma. Now, the problem with stigma of mental illness is really about the stories we tell ourselves as society. About over a week ago, I had severe right ear pain. So I check in with the ENT. The ENT examines my ear and he said, your ear is actually fine. The pain is actually that severe. He told me to describe the pain again. So I said, yes, I've been having this severe pain. I could not sleep. And he says, well, it's probably nerve pain. And he prescribed some medication. So when I went home, I didn't even want my husband to find out what the ENT had said because I thought if he finds out, he'll probably think the pain wasn't that severe or he will think it was all in my head. Of course, that's not what he thought. But looking at the medication I had been given and my husband being a doctor, I thought, well, it could go this way. So I just wanted it to stay with me. Why am I telling you a very personal story? Because as medical doctors, as health workers, when a patient walks into your room and you look at their previous medical records, there's some diagnoses you see, there's some prescriptions you see that make you biased about this patient. Once we find out why they're in hospital, we treat them differently. We don't give them as much attention. If someone comes into hospital and they're depressed, and they're a drug addict, they're an alcohol addict, we treat them like, oh, you should have tried better, you should have tried harder, you should have done better. We treat them like they're wasting our times. Ever had a nurse talking when they thought you could not hear what they said? She's a drama queen, doctor, on a conversion, and so on and so on. You're diminished before any treatment is even considered. I have done it. We've all done it as health workers. We assume too much. People assume too much. This is the stigma I want you to join with me to break and fight. When people are labeled, their concerns are not taken seriously. Even conversion disorder is a mental illness. If the people that are supposed to be helping us are not treating us well, who do we turn to then? Just hear, just listen to your patient. She's not crazy. She has mental health issues that need to be addressed. You wouldn't think the same if it was a diabetic or a cancer patient. All this patient needs is your time, your ear, and maybe a referral to a psychiatrist, a psychologist, a counselor, a therapist, a social worker. Mental pain is less dramatic than physical pain, but it is actually more common and even harder to deal with. And the frequent attempts to conceal the pain because of the attitude of society just increase the burden of it. Why is it easier to say I have a toothache than to say my heart is broken? Having a mental illness is not easy, but it is even harder when people assume you can just get over it. The most violent element of stigma in society is ignorance. There's so many misconceptions out there. People are afraid to speak out on mental health. People are afraid to say I have epilepsy or I have a drug addiction, but they can easily say I have a UTI. How ironic is that? We believe it's in someone else's family, not ours. Physicians don't want to believe that mental health occurs in their patients. Mental illness is not just a narrow compartment of health and wellness. It is rather a cross-cutting feature which should actually illuminate all medical approaches to diagnosis and treatment. One is a person first, and their mental health diagnosis second. All of us, health workers, society, let us come together. Let us stop treating people like they're problems, but let's treat them like they're actually people with problems. Stop treating parents like they just have spoiled kids that they did not straighten. These parents are already dying inside, wondering what they did wrong. We are pushing people into a life of self-harm, poor grades, unemployment, despair, suicide, and extreme physical ruminations. Sometimes these kids are not spoiled. Sometimes they actually have anxiety disorders, social phobia, dependence disorder, and sometimes it is a conduct disorder. Let us help people. People are dying of hopelessness. But I have a very big question today. What actually causes stigma? Ask yourself. When you get a broken bone, it can be seen on an X-ray. When you get an infection, the lab results will prove it. But in psychiatry, all you see is one's behavior, and behavior can be interpreted in a lot of different ways. The opinion of health workers on mental health starts before we even decide to go to medical school. Before I decide I want to be a doctor, I've been hearing myths, labels all my life that I just carry along into my training. This happens to all of us, and it's not our fault. But we can try to change this for the sake of our patients. How can we all make a difference? Now, let me tell you another very personal story. About 8 years ago, I had a lot going on in my life. Everyone thought I had gotten out of hand. One November day in 2012, my father said, "I've not known John to be this way. Something must be wrong." All those words echo in my mind up to date. Someone believed in me when everyone else was blaming me, when everyone else was throwing stones, when everyone else was making all sorts of comments. My father believed in me, and that is the reason I'm on your screen today, because someone believed in me. Maybe there is something wrong that needs to be addressed. Believe in people no matter what stupid excuses they come up with. You actually don't have to be a professional to believe in someone. Just be there. Pick up the phone. You will keep someone going. The feeling when someone cares is very uplifting. Take an interest in what people are saying in all situations. Show someone you believe in them. When I is replaced with we, illness becomes wellness. Doctors out there, when patients tell you something is wrong, don't think they are lying to you because all the examinations and investigations don't add up to their complaints. The least you could do is refer them to someone who can help them. The problem is people are not getting treatment until they're in complete crisis. So they end up having a lifetime of problems. I believe the more we talk about mental illness, the more we shall understand it. Learn mental illness with me. Watch out for my next videos. Subscribe to my YouTube channel. Now, my videos may not be as often or as frequent because I currently have a very tight schedule. But hey, once in a while, I'll pop in that video. Thank you so much for your time. Together we can fight and end the stigma around mental illness. Thank you for listening. Bye.